My name is Kelly Dickey. I am a sonographer at St. Louis University Hospital. I work in actually PRN in both the general and vascular and shortly echo department. So I do all modalities, kind of depending on where they need me that day, performing inpatient, outpatient, and ER ultrasound exams. I love the diversity of the job. I love getting to kind of test my knowledge in different ways and push myself for different exams, especially working at the hospital I do. I love that we do transplants and kind of the more intense exams that really make me work harder to get the right knowledge for the doctors. Anatomy was always my favorite subject, and I specifically chose ultrasound because of the close proximity with the patient and having that interaction with them and really being able to make a difference in their care. And that was what drew me to ultrasound specifically. A lot of working with the nurses of making sure the patient is able to get the test. So whether that's like going to the ICU and help me move this patient. For example, today we have a test ordered to do an internal ultrasound on a patient who recently got out of surgery and their entire lower half was an immobilizer, and the team wanted the test. And it was the nurse that we were working with advocating for the patient and saying this would not be tolerated well by the patient. We don't want to do that to them. So it's calling the nurse. They call and say, we want this patient after you. And so you're always just calling all over the place, trying to share the patient and get them through their care as best as possible. I think this kind of communication, after going through clinicals, it makes sense. But before that kind of moment of stepping into the hospital, it's like, I'm going to perform ultrasounds. That's what I do. An exam is ordered and I do it. But the second you get into clinicals, you see there's so much more involved, so much more patient care. The second that patient leaves their room and is away from the nurse, like you are their care provider. And there's a lot more that goes into the job besides just what you were hired for and trained to do. The pandemic has affected workplace obviously quite significantly in the hospital. We wear a mask, we ask the patients to wear a mask, and then it's calling every outpatient before they come and saying, you will be screened at the door, please wear a mask. It was scary to leave the house for a lot of people. So there was just a lot more, I feel like, communication with the patients, making sure that they were cared for beyond that specific exam we were supposed to be doing for them. So like we've been waiting a lot of the time for their COVID test to come back before performing an exam, mostly for PPE conservation, at least early on. So that way, if we could get the precautions lifted before we did the test, that saves on PPE for the hospital. But then after that, if the test came back positive for COVID, it was just so different calling the team and saying, do you really want this test? And they're saying, we don't want to put anyone in danger. Let me talk to my attending. Let me see what I can do. I don't want to put anyone else in danger if we don't have to. And kind of putting their, no, I want this test off to the side of saying, like, how can we make sure everyone's okay in this together? The team effort between different departments and different providers is so much more noticeable rather than like my department wants this and this team wants this, or it is so much more people working together of like, how can we best care for the patient, but how can we also best care for ourselves and our staff members during this time? My best advice to anyone entering the healthcare profession of that, although it is, you are hired for the job you are supposed to do, the hospital is a massive unit that it requires everyone to work together to get the patient the best care. And so know that just because your exam or your job is your priority, it might not be the priority for the patient at that time. And that that's something you have to acknowledge in order to truly work cohesively as a team.